Croup. Scary word for parents, right? But what do healthcare providers really need to know?
Exactly. Quick diagnosis, effective treatment, happy families. That's the goal.
So what's the most common culprit behind a Croup case?
Parainfluenza virus, but other respiratory viruses can also cause it, yeah.
Right. And the age group most affected?
6 months to 3 years old, little ones are most vulnerable.
Okay, let's define Croup. What exactly is it?
It's a viral infection. It inflames the upper airway. Think barking cough, stridor, hoarse voice.
Stridor. Explain that for our listeners.
A high-pitched, noisy breathing sound. It's caused by airway narrowing.
I see. So how does the severity show itself?
Mild croup, barking cough, hoarse voice, no stridor at rest. Moderate, stridor at rest, rapid breathing. Severe respiratory distress.
What's the first line of defense in Croup treatment?
Supportive care, hydration is key. Cool mist humidifiers can help at home.
Right. And what about steroids?
Dexamethasone, a single oral dose of 0.6 milligrams per kilogram, up to 16 milligrams maximum.
Okay. What if oral isn't an option?
Intravenous, intramuscular, or nebulized budesonide are alternatives.
When do we reach for epinephrine?
Moderate to severe croup. Nebulized racemic epinephrine reduces swelling. L-epinephrine is an alternative.
Important considerations with epinephrine?
Monitor closely for tachycardia and hypertension. It's powerful stuff.
Makes sense. And oxygen therapy?
For severe croup, especially if oxygen saturation drops below 90%.
Routine lab tests? X-rays? Necessary?
Not usually, unless it's an atypical case or other diagnoses are suspected.
Yeah, that's what I figured. Antibiotics? A common question?
Not routinely, only if a bacterial infection is suspected, like pneumonia or bacterial tracheitis.
When should we admit a child with Croup?
Persistent stridor, inadequate hydration, oxygen needs, atypical presentation, or respiratory failure.
Okay. And when can we send them home?
Minimal or no stridor, able to talk and eat, well hydrated, stable for at least 1 night.
Let's quickly recap. Common cause?
Parainfluenza virus.
Most affected age group?
6 months to 3 years.
First-line treatment?
Supportive care and dexamethasone.
When to consider epinephrine?
Moderate to severe cases.
Any other crucial points healthcare providers should remember?
Always assess the child's overall condition. Don't just focus on the numbers.
Good point. Clinical judgment is paramount.
Precisely. And always stay updated on the latest guidelines.
Excellent advice. What about corrective education?
Reassurance is key. Explain the condition clearly. Answer their questions.
Let's address some common misconceptions. Cool mist humidifiers in the hospital.
No proven benefit. Hydration is more important.
And routine viral testing.
And generally unnecessary.
That was a great discussion. Thank you for clarifying these important points.